Hey guys, Dr. Ina from Ageless Body Clinic. I'm here today with my partner and a friend, Dr. Maha. And we're going to talk about a very controversial subject today, which is promising and interesting, but controversial. So, the topic of today's discussion is ketamine therapy. We started doing ketamine therapy at Ageless Body Clinic around a year ago. And the reason why we actually wanted to do that therapy here, because we started facing a lot of people, patients, who were experiencing some mental disorders, such as depression, anxiety, obsessive compulsive disorder, loss of sleep, and a lot of different other symptoms that the doctors didn't put the diagnosis, which call it like a depression or anxiety. So one of my colleagues, she offered to do ketamine therapy, and I didn't know too much about it, but I've heard, different things, positive or negative. So I'm that type of a provider who want to try everything before just offering to our patients. So me personally, I didn't try it yet, but she sweared by it because of her personal experience. So we started slowly implementing. And what we've noticed that people who go through ketamine IVs, they experience a lot of happiness, and they experience calmness, and they experience some sort of content in them. But then a week or two later, when they were coming back again, they were saying that everything that they experienced, they didn't feel any change for a long time. So what we decided to do, when Dr. Maha joined the practice, we decided to create ketamine therapy as an integration. Mm-hmm. So in more details, Dr. Maha will tell you her thoughts, her beliefs, and how is she planning to integrate ketamine therapy at Ageless Body Clinic.
Thank you, Dr. Ina. That was
Sure.
really good introduction. So I agree with you. It is controversial and it's not very well understood because it has not been approved for that long to use for depression. So let's start by, because Dr. Ina asked me first to explain in a simple way what is ketamine. Ketamine is an anesthetic, and it has been, it was synthesized first in 1960s. The FDA approved it for use in the United States since 1970 as an anesthetic. But because of its properties, and one of the two main properties that are relevant to our use is that antidepressant effect, which was noticed by the doctors who used it for sedation as an anesthetic, and of course the pain relief. And the other thing is called dissociative effect. So what is dissociation? It helps the person literally dissociate from the sensations of pain, and that could apply to physical pain and emotional pain. So you can see the value that has for people who are overwhelmed with resistant to treatment depression, severe anxiety, PTSD, mm-hmm. Which repeatedly fail treatments. Mm-hmm. Most people who seek ketamine usually have tried drugs like drugs like antidepressants, mm-hmm. Anxiolytics. They tried therapy and it didn't work. So ketamine offered those individuals a window, mm-hmm. To be able to have a holiday, have like a week break from that immense sadness or anxiety or overwhelm that people sometimes fall into after trying to get out of.
So let me ask you a couple questions.
Please.
So tell me, since we are planning to do the integrative approach at Ageless Body Clinic, could you please tell us, first of all, what are the contraindications of receiving the ketamine, and what people need to do prior to try ketamine, prior to come and treat with us here? What do they need to do?
Okay, let's start with the contraindications first.
Yes.
So usually the medical reasons that exclude their capacity to receive the treatment. First, severe psychosis and schizophrenia. So people with severe mental illness, they will not benefit from this because they cannot handle the dissociation. The medical reasons would be severe heart disease, hypertension, severe hypertension, not mild, and
What
you're
is severe hypertension?
So very high, the high would be 160 over 120.
Okay.
You know, that would not be because the reason is ketamine itself could raise your blood pressure. So usually we handle it because we have medications in case that happens. So if we want you to start with a lower, normal or little bit high blood pressure, so that if it goes up, it's safe for us to lower it.
If the hypertension is actually controlled by medication, is it possible for those patients to get ketamine? Or
Yeah,
no?
if it's controlled, yeah. It's the uncontrolled severe hypertension that we worry about. People who have aneurysm, again, because of the elevation of the hypertension, people who have severe heart disease. So mild heart disease, no, but somebody who had like 5 heart attacks, and we cannot really play with that.
Got it.
Pregnancy, no pregnancy. And if you're lactating and nursing also, because the substance will go into the baby, so you cannot do that.
Okay.
The other question you asked me is, what do people need to do? It's an option, okay? It's not like, oh, you have to try everything else, and there's a high failure rate in antidepressants and anxiolytics anyways. And if you feel like this is something you'd like to explore, I think you should just come and have a consultation. However, I do suggest having an understanding that ketamine by itself is not going to fix the problem, right? People are depressed for a reason. People have anxiety for a reason. People have PTSD for a reason. So if you come, I think I would advocate that come with a mindset that you'd like to do more of an integrative approach. Because now, thanks to you, Dr. Ina, we're offering complementary therapies along with the ketamine, which will include art therapy. That's very important. It will include what we talked about the other day, the trauma release exercises. There is, most people know emotional freedom technique known as tapping. And there is something called matrix reimprinting, where we go, it's a fancy name, it's just saying we go to your memories and help you walk through it. Everyone in this world has trauma. I don't care who it is. And if somebody says I didn't, I'll be like, were you alive when the COVID pandemic hit? Were you under house arrest for years? That was trauma. So everyone has trauma, and as humans, we had to devise ways to cope. And most of the time we do that by shutting down or quarantining that experience, which works for a little bit, but then eventually the cracks will open, and it's best if you go and look, but have somebody hold your hand as you go and look.
So with ketamine, which is going to be a very big portion of that integrative therapy, because people can go separately and do art therapy or emotional freedom technique or any other stuff, but the beauty of our approach is to combine both under the same roof.
Agree.
So this way they know that they are under this doctor's supervision.
Correct.
That the doctor actually respects and does the therapy, the integration itself. So
Correct.
Because a lot of, from my experience, a lot of psychiatrists, they might be in favor of ketamine, but they're not exactly talking about integrating other non-medical therapies to the patients, because either they're not taking it too seriously, or they think that the patients can actually get it somewhere else or at their comfort of their home. So they're not stressing the importance of it. And I believe, as a person who is a doctor myself and went through series of hard events in my life, I truly believe that only integration and a proper environment and the proper support around you can truly heal you.
I agree with you.
Okay, so my next question would be, how many ketamine sessions and how often the person needs to come in order to see the change and the shift?
So there is something called the induction phase, which is coming 2-3 times a week, 2 to 3 weeks. That's the induction. And then once the induction phase finishes, we sit with the patient, we reevaluate where they're standing, and depending on their response, then we can switch them over to maintenance therapy, which would be one session every 2 weeks or 4 weeks or even 6 weeks.
So it all depends. Everyone is individual, and it all depends on how the patient is progressing. Correct.
And just that the effect usually, it's said that you see the changes after at least 3 sessions. But I think that's because they took it as them by itself, not with integrating.
Not with integrating.
Yeah.
Do you think that if the patient comes here for the ketamine, we can integrate it from the first time, or we first do the ketamine session and then we start implementing while they're coming along?
I think the best thing to do would be, like, ideally, is to first we have a consultation and see where they stand. So of course, if somebody has already done things in the past and they have done other modalities, non-medical therapies that they've done, we can talk about that. There's so many modalities out there: EMDR, NLP, neuro-linguistic programming. There's of course psychotherapy. There's all kinds of therapies out there. So somebody who's not novice to these things, we can arrange to have them, if they prefer, to start with a session first before the ketamine. But I think an accepted method would be they come, we talk, we see where they're at. I would do like some questionnaires to see where they're at the scales, to see their mental health, where it is, get the ketamine, and usually the integration session ideally to happen within 24 to 72 hours. They come separately to have an integration session where we see, because when you get it, you'll have memories, you'll have feelings, you'll have even sometimes like visions, not visions, like you see things, and from your past when you were little, and it would be good to sit and talk about what they thought about it, what they felt, and then we can implement the modalities that we offer. So that's what I think. You come for the ketamine, you get it, after a day or 3 days, you come for the integration. Best 1 day later.
Got it. So the ketamine IV, usually how long does it take to receive the actual IV?
The actual IV is 40 to 45 minutes. But usually you need to come like 20 minutes earlier, because we need to check your vitals, talk to you, see where you're standing, how you're feeling. Some patients come, they're already anxious. We had one recently. She was very anxious, so we can offer like something to calm her down, like tapping, like maybe just talking to her. So it's better to come like half hour earlier at least to get things ready. But the actual infusion is 40 minutes. And then once the infusion is done, we check the vitals again. We have to observe you 30 minutes to make sure they got out of it, they feel very well. No driving that day, so they have to arrange for someone to come pick them up. And if everyone is happy, we're satisfied, the person looks good, somebody's gonna come take them, they can leave.
So guys, this is just the introductory for ketamine therapy, and more videos will come and educate you on integration of ketamine and other therapies to make people feel calm, content, trusting, and actually get rid of their mental problems that maybe they carried for a long time. So I know it's a very delicate subject. I know that some people are shy or very close to talk about it, but it's very confidential. So everything what we do with you here in the clinic is confidential, without any type of discussion or posting, or unless the person is actually wants to be like a study person, then it's a different type of case. But majority of the cases, don't be shy. Don't think that your case will be somehow discussed online or any other ways. So if you have any questions, comments, or you want to share your experience with ketamine, please write to us, and we'll be gladly answering your questions, your comments, and definitely if you are in Miami area, please stop by and experience for yourself.